but not least, we have Jay Watts. He is the head of the Trans Health Program at Thundermist Health Center. For the past 10 years, he's played a key role in organizing activism and policy change efforts for Rhode Island's transgender community. He's used his professional and life experience to educate thousands of Rhode Islanders on LGBTQ-related topics, with a focus on building competency in medical and behavioral health settings. He also has a master's degree in social work from RIP and a bachelor's degree in music therapy from Mansfield University. So thank you so much for being here today.
So I did not write out the speech. I often do trainings with slides, so I'll then try to keep myself like on a topic, because I could easily go off and talk about different things that are not necessarily the thing that we all should hear about tonight. So just a quick little overview of Thundermist Health Center and what we're doing. So we're a large community health center. We have 3 locations across the state, so Woonsocket, West Warwick, and South County. If you haven't seen them lately, both of our Woonsocket and West Warwick locations have undergone major renovations. West Warwick is still a little bit in process, but most of it is done. The entire time I've worked at Thundermist, we've been under construction somewhere. and so it's really great to see just the really beautiful facilities that are coming out of this work. So the Trans Health Program at Thundermist is, just a little piece of what Thundermist does across the whole community. So our Trans Health Program started in mid-2015, and this was provider-driven. So this came out of both providers saying, we recognize there's an issue here, we want to address it, as well as community members saying, we need someone to help us, there's no one here to do this work. So when Thundermist said, if we're going to do this, we're going to try to address transgender healthcare needs across the system. So I was hired to launch this program, and at the time that I started, we had about 40 existing patients who were identified as transgender within all of Thundermist. We just hit over 765 patients in our program within 3 and a bit years. We see anywhere from 20 to 30 new trans-identified patients each month entering our facilities. My team started as just me, as a licensed clinical social worker, doing behavioral health and also supporting our medical providers in trans healthcare and doing advocacy with our referrals coordinators and prior auth folks on how to make sure that insurance was covering this, to there being way too many things for me to do by myself. I now have a team of 4 and 2 more positions that we're in the middle of hiring for. 2 of those positions are licensed clinical social workers who are also adding behavioral health support for our patients. The 2 of them are peer navigators. These are trans-identified people who are at a case manager level, and it's about having lived experience as a trans person and helping our patients walk through the process of whatever, navigating their system. So for our patients who are younger, it may be just how healthcare works in general, or it could be really specific around surgery, access to care, or how do I get my name changed, or helping me talk about coming out to my family, or taking someone shopping to buy clothes when they don't have anyone to go with them. And so we're providing a wide range of supports through our peer navigation positions, which I'm really excited about because they really are the only positions that I know of in the state of Rhode Island that are specifically in the job description. They have to be trans people and lived experience as a trans person. So, we started this program because, like I said, the need of providers and community members. There were very few resources in the state. We knew of about 5 medical providers who had put themselves out there who are doing trans health. 2 of them were at Thundermist, and they didn't really want to hang up the shingle and say we're doing more of this because of the systems issues in the health center that they wanted to see addressed first. 2 of them had closed panels. So the only way that we could get folks into those systems, so me as an advocate in the community, folks would just come to me and I'd hear messages. So 10 o'clock on a Friday night, my phone would ring, complete stranger, I heard you can help me find a doctor. Those are the kind of advocacy work that I was doing. And because you had to know the secret password to know who the provider was, and it was please let me in, I'm trans, but no one knew that. And so I was trying to navigate these systems all underground and creating networks, including when my own primary care provider, I had 4 different doctors in 4 years because folks kept leaving and changing practices. And I wasn't just moving my care, it was me and a good 100 of my friends who were also being left, like, where are we gonna go? And so I was organizing this care for our entire community, like long before Thunder Mist existed. But so, we now have more than 25 providers at Thunder Mist alone who are doing this work. And we've seen this also ripple out into other practices and folks feeling like they can feeling confident in doing this work as well. So we know there's been increasing visibility about trans rights and trans issues that are continuing to emerge. And that this is a really underserved population. And Thunder Mist sees this as part of our mission as a community health center in taking care of marginalized individuals and making sure that this is addressing the health disparities that are faced by this population. A tiny little bit of data that's Rhode Island specific. This is from the US Trans Survey, which overall had about 28,000 respondents. Rhode Island, we only had about 100, so the data is not, it's smaller than I'd like. It's only, a lot of it was not statistically significant. But they said, 24% of folks in Rhode Island reported experiencing homelessness. And when I talk about healthcare needs and healthcare needs of the community, one thing that I want folks to think about is the other determinants of health that really impact our folks. So while we can provide the medical care, my patients are having trouble finding housing or showing up to look at an apartment and being turned away by landlords when they see that they're visibly trans, and are not being hired for jobs and that they're very qualified for. And this is continuing to happen, even though Rhode Island was the second state in the country to pass laws protecting people based on gender identity and expression back in 2001. And so other things on here, we know that only 16% reported that they had the name and gender marker changed on all of their IDs, and that a large percentage, 50%, had none of their documents changed. In Rhode Island, we've actually, and something I'm proud of, we've done a lot of work around this to make it easy, but the process is really, it's inequality in that, depending on the town that you live in Rhode Island, the amount of money is different. So it's really skewed towards what town do you live in over whether you can afford this or not. So in Exeter, my cost, I think, was $135, where North Providence was like $68. Like, there's a wide range of what the cost is, and getting folks' names changed. And then folks who are avoiding using a public restroom out of fear of harassment and their safety. So this is a real experience of trans folks. Again, this law has been on the books for 18 years that folks can use whatever bathroom they identify with, but folks continue to experience, as trans things have become more visible, people are feeling more vulnerable. So while things are still, we're coming out on the side of affirming people's identities, and so we're going to win these fights, but just the fact that people get to have discussions about whether or not trans people get to exist and live in the world is creating the stress that we're seeing in the community. Okay, so one of the big exciting things that I have to share is that in 2016, we became one of a handful of states that added health insurance that said that Medicaid had to cover gender-affirming healthcare. Prior to 2016, there were specific clauses in those insurance plans saying they would not cover trans healthcare, and that was legal. And so it was within the same week, both Medicaid and the Office of the Health Insurance Commissioner came out saying that both commercial plans and Medicaid plans had to cover this. The governor followed suit about 6 months later and mandated that all state employee plans covered it as well. Where we see the gaps that exist in Rhode Island, are fully insured plans, which falls into a lot of municipalities. So municipalities that have their own self-insured plans, they don't have to follow these rules. And so if we think about where some of the advocacy efforts are, go back and look at your own insurance policies. If you work in a place that has a self-funded plan, don't wait for a trans person in that place to step up and say, why won't this healthcare take care of me? Step up and make the change, and make the change now. We know that, so Medicaid has some exclusions for surgery for those under 18, which at some level sounds like, well, who's having surgery under 18? It's the 17-year-old kid who's going off to college before they turn 18 and wants to have surgery before they start school. It may end up delaying going to college. because, and then delaying, all of their goals in life because we can't have this timed to happen in that summer before school starts. So that's when we talk about that, trying to push that forward, that has become an issue. Another policy is that while trans healthcare, so things are covered, there's part of this that's just not equitable. So what we see is that the policy, or we look at medicine for trans men and trans women and think you're both getting the same things. But there are some procedures that trans women need to have access to that trans men don't need, so they're not being covered by these plans, particularly electrolysis, and particularly around facial surgery to alter bone shape that cannot be done by medication. Those are really big safety and really big safety factors for trans women and helping trans women to feel, to have access to equitable care that are not being covered by most plans in the state. And then there are arbitrary barriers around who gets around surgery that are not necessarily in line with contemporary standards, but then even when we have all of that stuff, it's hard to find surgeons that are able to do this work. Okay, so ongoing stressors that exist in the community, legal documentation barriers, the housing insecurity, access to shelters that are a big concern, the unemployment and job discrimination. Sex segregated systems includes things like going into a sober living environment, or accessing recovery services, or any sort of gendered spaces where folks may not feel safe or welcomed. And then there's this rising political interest in targeting trans lives. Like, trans people have always existed, but there's become a more recent recognition that trans people are here. And what we've seen happen is a lot of the marriage equality movement type people, as we won that battle, that same energy, sort of the same groups of people are now shifting their focus and targeting trans people. And so there's some really specific agendas around targeting the lives of trans people that's going on that folks should be aware of. And we're trying to, Rhode Island's in a good place on this stuff, but there are still national things and things in the state that we want to really keep an eye on and make sure that things don't get worse for us here. So around taking action, what I need you to do is hire trans people. You have trans people who need jobs, who be able to specifically say, you're specifically looking at strongly preferred of having people of color, people who speak Spanish, of hiring LGBT people, particularly trans people, particularly trans women of color. The same thing about renting and creating access to spaces, because my folks we have a big problem there. Again, the advocating for equitable coverage around surgeries and those self-insured plans, which is a really simple thing to go back and get your exclusions clause in your insurance plan and then say, why is this not being covered? Because it should be covered. And then for more information about the national trans health movement, things that are going on, there's the transequality.org, so the National Center for Trans Equality. They are organizing specifically around some of these issues. There's some concerns nationally about doctors being able to opt out of seeing trans people and treating trans people for basic needs. And so if you're really interested in that health policy, then these are the places to go and sign up and get information to be on the alerts of what's going on in those areas.
Thank you. So I have a question for Jay before I get to some of the others. Recently there was an attack on trans people in Providence, or reported attack, and I know many of us here have heard about that and are very concerned, and I wondered if you could offer us any thoughts on anything specifically we can do as a community to be helpful in that situation or to help prevent such acts in the future.
I mean, all I can say about that is, and based on reports, because I don't have any personal information or knowledge about this, but it sounded like from reports that one of the critiques was there were bystanders that didn't do anything. And I know that requires folks being really scared about saying they're doing something and putting themselves at risk. But that's one thing of sort of when we see that those things are happening, the either helping, getting help. But that seemed like that was, but I don't know, I can't, so there are more that, like, the more visibility that the community is having, the more I'm hearing about like these kinds of things. Like, that's not an isolated incident. This one made the news, but there are similar, maybe like a, you know, a step down or more micro level or passing level of things that are happening every day. And it's part of the climate of what's going on right now, of people feeling like they have a right to say that trans people shouldn't exist. And so when folks are visibly trans, you can be feeling really vulnerable and scared. So, but I don't know what else to say.
If I can add to it, I think there is such work that can be done by community groups such as yours. As a group that is organized, that has a constituency, that is part of the fabric of the community, you can have those conversations. You can recognize that an event happened and then help through forums and discussions, help the community, one, understand, help the community find ways to address the harm that event caused to the community, and then find with the community, build what we call resilience within the community to come back stronger than before the event. Because we look at those events and definitely that is extremely traumatic to the individual itself, to that family, but it also has a cumulative effect at the community level that if left unaddressed, that's how you can then have trauma that truly impacts beyond just that event that continues to perpetuate itself. So convene your partners, convene your friends, have those conversations, call it, name it. Once you name it and you call it, it becomes much more easier. Not easier, it gives it a platform to be addressed.
And that's vicarious trauma that we see experiencing throughout whenever these events are happening or going on. I will say around building community, some of what Thunder Mist provides, it's not specific to Thunder Mist patients, is our wellness activities. And so people should be aware of these. So on the Thunder Mist Facebook page under the event section, we post them, that they're grant-funded events. There's now like 5 or 6 a month that are happening that are events for trans people, for trans spaces, and trans folks can bring in cisgender guests with them. But we started with swimming. So once a month we rent out a pool, and in that space it's for folks to wear whatever swimwear feels most comfortable, change, and the locker rooms are all made gender neutral, and it's about just having a safe space to go and do an activity that people feel incredibly vulnerable doing in mixed spaces. We've added yoga, we've added acupuncture, and we've also added game night. So these are about building community and resilience. So the folks that are going to game night are not necessarily the same folks that are going to yoga. But game night is around social wellness and
Mainly
building,
a Trivial Pursuit, though.
like board games. Yeah. So being able to, it's pizza and board games, and it's really about building social connection. So the more that we see folks being able to find each other and being able to feel less isolated and having connections, I see that as one way is that we're foundationally strengthening the whole community.
Can I add my 2 cents to this? And that is, and this is a shout out to your legislators here. I would assume that you have codified into law the rights of trans people. And if you haven't, shame on you. That is step number 1. Find out. Make sure you codify into law that they have the same rights as everybody else, so that when there is a transgression, such as what must have occurred here, they have broken the law. This isn't something simple. This isn't something that you just turn your face and look the other way. We've gone through 2 issues now, 2 major issues in terms of public facilities. We had a referendum last time. The first time we've ever had a referendum, that there was a referendum across the country on the use of public facilities.
I will say that's one place where, for whatever reason, Rhode Island has been far ahead of Massachusetts. Because we did it about 17 years ago.
Are you using it though?
But that's the thing, right?
You
So it's
can't-
been
It's not
there.
good enough just
But are
to,
folks not knowing that it
you've
exists?
got to
and
use
they
it.
have those rights?
You've got to use it so that they can find apartments, so that they can find jobs, so that there isn't this sense of alienation and social ostracization. That, I think, is the role of the legislature. That's a very powerful role.